Thanks, Bree. We'll see you then. It's a familiar line. COVID cases are spiking across the U.S. Unfortunately, that is the case right now. It's all due to the most dominant strain of COVID-19, the subvariant known as B.A.2. Both the East and West Coasts are seeing a spike in COVID cases, but what's happening here in Idaho and what are our experts keeping their eyes on? Katya Stepovic found out.
Doug, while we aren't seeing an alarming uptick in COVID cases, so to speak, experts worry that could be in Idaho's future because unfortunately B.A.2, this subvariant, is even more contagious than the rest of the variants that we have yet to see.
We've been enjoying a very nice lull after our first Omicron surge.
And while Dr. David Pate, former CEO of St. Luke's Health System, doesn't want to sound the alarm of a potential new COVID surge yet, he's not liking recent trends.
Some of these foreign countries have had very big surges. Canada is ahead of us. They're starting to have their surge already. We'll have to see what happens here. This B.A.2 now is dominant. It's the predominant strain all across the United States, particularly so on the two coasts and particularly up north.
While it's too soon to say if B.A.2 is less or more severe than previous variants, one thing is for sure.
Each variant has gotten more contagious. That's what we have to worry about. Now, Omicron was the first one to overall in the population cause less severe disease.
And while current vaccines are holding up pretty well against the new subvariant, he doesn't want Idahoans to get complacent.
It could cause lots of cases, lots of infections. And given that our vaccination rate isn't great, yes, we could certainly see a lot of hospitalizations, even a lot of deaths. I don't think anything's going to put us back into lockdown.
Dr. Pate says it's too soon to say if B.A.2 will impact Idaho the way it has in other states.
You may recall in Alpha, way back to Alpha, Washington and Oregon had a big surge with Alpha. We didn't in Idaho. I have no idea why we didn't, but this virus is not totally predictable. So I do think we have to be prepared, although it's not a certainty that we're going to have a surge.
Yes, and many of you probably picked up on what I said. I meant to say that this is the most contagious variant we have seen. Now, again, Dr. Pate says it's impossible to predict its impact or lack thereof even on Idahoans. However, he says right now the state is not getting as much funding for things like antiviral treatments or even COVID testing. So it's important that we all stay vigilant, and those who are not vaccinated maybe consider doing so now. Doug?
And of course, we'll keep an eye on B.A.2 just as Dr. Pate is. Katya, thank you very much. Meantime, Idaho's public health disaster emergency declaration expires on Friday. It's been in place since the start of the pandemic in March of 2020. Governor Brad Little said the emergency declaration allowed the Federal Emergency Management Agency to cover costs associated with distribution of critical supplies. Idaho still has a fund set up to respond to COVID-19 if anything changes.